Hello, my name is Dr. MarkAlain, Dery, and I am the Medical Director of Infectious Diseases and Chief Innovation Officer for Access South Louisiana. I live in New Orleans, that's probably obvious, and I serve as co-chair for the ACOI Infectious Diseases Subspecialty Section. You've seen me do these updates now for the past few months, and months, and months. We've been doing this for a while. Thankfully, because this is how we keep up with information. So I do hope these messages are helping you keep up with the latest of COVID-19. I know that many of you are in the thick of the fight, and I'd like to thank each of you on behalf of all of us who focus daily on infectious diseases, and certainly on behalf of the ACOI who've made these videos possible. So moving together with the ACOI, we'll continue to share information as it becomes available, as well as some of the hopeful progress that we are seeing. So on to some great stories. First, we're going to talk about gatherings and gatherings bound. So it's gone to the point where infections are breaking records daily. You've probably seen that, and at the time of this recording yesterday, there was the highest number of deaths from COVID, almost 3,000. So now that Thanksgiving is behind us and there are new warnings that if you are one of the Americans who celebrated Thanksgiving with people outside of your household, just make the assumption that you're infected with COVID-19. That seems like a fair thing. The CDC warned about holding large gatherings and traveling to see family over Thanksgiving. So why didn't you heed their warning? And while traveling by air was down by 1/2 from last year, Americans still did what they do, and they flew across the country to eat pumpkin pie with their loved ones and their tofurkey, vegetarian right here. And at the same time, they were likely transmitting virus. Shame on you. All right, so the Federal Task Force on COVID-19 is warning that those under 40, that's you, that they're probably infected if you traveled, but you may not see symptoms just the same, but possibly transmitting unknowingly. The other warnings is that seniors over 65, that may be you too, I see, they're asking those individuals to not go out in public and to have groceries and medications delivered instead. It's just not everyday Americans who are not heeding the warnings about gatherings. It seems like, could it be officials, politicians, lawmakers? They don't follow the rules? But officials from California to DC are gathering, and they're dismissing the risk. So who do we have here? So the State Department in DC, sent out 900 invitations for one Christmas gathering. Apparently on the 8th floor of the State Department, it's very posh, and yeah, I'll never see it, and I probably don't have any interest to seeing it. But anyway, 900 invitations, Christmas gathering. All right, but California's governor, that would be Governor Newsom, attended a birthday dinner gathering at a restaurant in Napa Valley, French Laundry. Why would anybody name their restaurant French Laundry? Anyway, very swanky. He went to French Laundry, and apparently their wine bill was like something like just $13,000 just by itself. But anyway, that may be just a rumor. Now, strange enough, the mayor of San Francisco, London Breed, come on, why would you do that? Anyway, Mayor Breed attended a birthday gathering the day prior at the same restaurant in Napa. Remember, it's called French Laundry. Write your own jokes there. Anyway, the mayor, okay, so listen to this one. So it was the mayor of Austin, though. He took home the bacon. That's a vegetarian making that joke. Anyway, the mayor of Austin not only gathered with others at a wedding, but traveled to Mexico. It was his daughter's wedding, but traveled to Mexico all the while warning citizens to stay home. Since cases in Austin we're seeing more COVID-19 cases than the 2 previous months combined. So instead of eating pumpkin pie, shouldn't they be eating humble pie? Anyway, quarantining doesn't have to be as bad as it once was. Take it from this dude who had to quarantine twice for 14 days. But now the CDC has improved, has changed their recommendations in hopes of improving compliance to quarantining, and the CDC recently came out with some recommendations that now offer 2 new ways to shorten quarantine periods. Those without symptoms, so if you've been exposed to somebody with COVID, those without symptoms may end quarantine after 7 days if they test for the virus and they're negative. Now, of course, this is a PCR test. Now, if they do not test, they can go 10 days. So they previously indicated that the 14 days that was the previous recommendations is still the most certain way, but their hope is that this shortened quarantine period may be easier for Americans to swallow. The other way that I look at this is this. There are going to be so many cases, and I need to say this a little bit more seriously because it is very serious. We've been talking about this for months and months and months, and we knew that we would get to this point. It's almost like, I don't want to say I told you so, but I kind of told you so. There are going to be so many cases, and here's my personal recommendation. Do not be in a room with somebody, because eventually they will become positive and you will be quarantined as well. And our colleagues, as us, I know that we should not be getting quarantined because we need to be working. And so we really need to be avoiding any gatherings whatsoever. Over the course of the next couple months, in all seriousness, we're going to start seeing some numbers that we would have never thought possible. And we all need to work together to make sure that everybody remains masked up, right? Everybody needs to remain masked up, and everybody needs to also recognize that we need to treat our holidays different this year. Okay, so let's talk about some vaccines, because this is really exciting. Vaccine updates, and we're going to start probably doing more vaccine updates as we move along. So now we see that vaccines are on the horizon, and recommendations are lining up as to who first should be in line to receive the dosage. I know that here in New Orleans, I am one of the first people that will be lining up to get. We're going to be getting the Pfizer vaccine, so I will be first in line to get that Pfizer vaccine. I'll roll up my sleeves, not this shirt, but other sleeves. But this morning I did see a tweet from former Presidents Clinton, Bush, and Obama, and they are actually willing to be inoculated live on TV to prove that it's safe. I think it's a great idea because in the 50s, late 50s, when the polio vaccine, and I'm almost positive it was the Salk polio vaccine, which was the killed virus, and those of you that were around can correct me on this, madery@mac.com, but it was the Salk poliovirus vaccine, and it had a very low uptake in the U.S. Elvis Presley went live on TV, rolled up his sleeves, got an inoculation, and 3 or 4 months later, there was an increase by 70% or so. So it's super important for the previous presidents, Clinton, Bush, and Obama, and we're actually going to be doing something here in New Orleans where we're going to be looking at public health leaders, as well as the mayor, the health commissioner, and we're all going to be doing something very similar to show how safe it is. Now, the CDC just yesterday, at the time of this recording, also made some very specific recommendations, looking specifically at who should be first: healthcare workers, as well as employees of nursing homes and long-term care facilities, as well as residents as well. Unfortunately, the death toll for these facilities have been significant, reaching almost 40%. Now, Pfizer and Moderna, remember Moderna, mRNA vaccine, Moderna, M, and it ends in RNA. So if you ever need to remember how the Moderna vaccine works, it's M for Moderna, and it ends with RNA, mRNA. Now, they've estimated that they will have enough to vaccinate about 22.5 million Americans by the end of the year, including the required 2 doses, which are 3 weeks apart for Pfizer and 4 weeks apart for the Moderna vaccine. And if all goes as planned, the companies would be able to provide an additional 60 to 70 million doses in January, enough for 55 million people at most through the end of January, and about 22% of the U.S. Adult population. We would need at least 75% of the total U.S. population to be vaccinated for us to get back to a pre-COVID normal. So in spring, there should be hopefully more than 150 million doses a month in March, April, and May, and that means that the rest of the general population will likely be able to be vaccinated by May or June. A member of the panel advising the CDC said that she's mindful of equity concerns. That's good, because so am I. I agree with this member, Dr. Lee, that special attention should be paid to healthcare workers, but healthcare workers in low-paying positions, such as nursing assistants, food workers, janitors, and the likes. Those are the folks who likely fear for their job security if they push to secure a spot toward the front of the vaccination line. So it's upon us to make sure that all of us are at the front of the line to make sure that we're all vaccinated, and that the process of equity and equitable distribution of the vaccine should be paramount for all of us. So please continue to stay on the lookout for our regular updates, and to read more from our sources used in this report, go to the acoi.org/COVID-19. Together with the ACOI, we can help you have the latest information to help you respond to your patients and stay on top of the crisis. Also, please feel free to reach out to me directly at madery@mac.com. Please stay safe, because we can do this together.